Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock from the Marketing Department at Salina Regional Health Center. With me to discuss vein disease, I have Dr. Justin Clausen. Dr. Clausen is with Salina Regional Surgical Associates and is one of the physicians who works at the vein clinic. And Barb Jake. Barb is a nurse practitioner at the vein clinic. Thank you very much for being on the program. I did mention that you were one of the physicians. I know some of the other physicians as well. Is that correct?
Yep. Dr. Toon is a cardiothoracic surgeon, is also involved in the vein care clinic.
Okay, very good. As a layperson, I think vein disease, well, I really don't know what I think about vein disease. What exactly are we talking about?
Most people kind of recognize vein disease as varicosities or bulging vessels in the lower extremities. You know, everybody thinks they're disfiguring and don't look good, but the underlying process really is just an inability for the body to return the blood to the heart effectively. The veins become incompetent, they're dilated, and the valves that usually help hold the blood in place and return it to the heart become deficient and actually cause flow in the opposite direction. Most people will describe a heaviness in their legs, fatigue. They can have burning, itching, aching. Usually many of these things happen after standing for prolonged periods of time.
Okay. Barb, let's switch to you. Some of the symptoms he just talked about, if people are feeling those and suspect maybe vein disease, what's the best process for looking into that?
Well, if they've ever talked to their primary care physician about some of those symptoms, we are happy to take referrals from primary care. They don't have to have a referral, though. They can just give us a call, and we're happy to schedule an appointment to be seen by one of the surgeons. They can expect to come in, be evaluated, and sent out with a projected plan. There are 3 basic procedures that we do in the clinic. Laser ablation, and that's just closing a big vein. We do a phlebectomy, which takes some of the smaller veins out, and then injections with a medication that will close down some of the smaller veins.
What's the kind of the recovery time and what people expect to see?
All of these procedures are really well tolerated. They're pretty minimal risk involved. Pretty much all of the procedures we do can be performed right there in the office, as Barb was saying. They involve the laser ablation, where we actually put a laser in through a very small needle into the vein and burn it shut. They come in, like she said, and we can have them out within about an hour or 2 afterward.
Okay. Well, thank you very much for being on the program, and thanks for all that you do for our community. And thank you for watching. For more information, please visit srhc.com and like us on Facebook for the latest news and updates.